Hi, this is Dr. Michael Ryan with Missouri Vein Care answering the question, are spider veins dangerous or harmful? The short answer is for the vast majority of people, spider veins do not represent anything dangerous or worrisome. Spider veins are a very common feature of a vein condition. It's probably present in over half the population to some degree. Most people have very small spider veins on their legs, often around their ankles. And what it represents is that the circulation inside the veins feeding into that area of the skin is not working normally, and the little tiny valves that allow the blood to be flowing in one direction have failed, and the blood now can go in two directions, or a reflux, as we call it. When that happens, extra pressure can build up, and the result of that is visible veins. They first start um, by becoming visible, and they're tiny and fine, feathery, small veins initially. As the pressure builds up over time, those veins will also become bigger, and they actually become distended, and they then begin to protrude over the surface of the skin. These are still relatively small veins, but they become more noticeable, more prominent, and often they have a pattern that's called a starburst pattern, so that the the appearance is like a little explosion, a fireworks explosion, and that is due to the fact that often as this pattern of veins has developed on the leg, there's one feeder vein under the surface. Often you don't see it, and that vein is responsible for bringing all the pressure in, and all those veins just grow out like a flower over time. So for most people, this is not a dangerous condition. It's not associated with heart disease or heart risk or heart attack risk. It's not associated with a risk of blood clots or DVT. It's also not associated with a risk of any artery conditions, also called PAD. And there's no risk because of that of losing your leg or needing an amputation if you have spider veins. There is a small risk associated with spider veins, and the risk is that the spider veins themselves can become so fragile and so thin that they can break open. This occurs when people are shaving, or they're maybe working in the yard, or they're uh, scrubbing their legs when they're showering. And when the vein has become that fragile, and usually it represents something that's pretty remarkable to think about. There's essentially two cell layers thick between the blood flow and the air. It's the cell layer of the spider vein and the cell layer of the topmost layer of the skin, and those are very thin. And so when they break, it can lead to very dramatic bleeding. And the reason why the bleeding is dramatic is because the cause of most spider veins is a very high amount of pressure in the vein circulation from these abnormal vein valves. And when there's a high amount of pressure, when that vein is nicked, it will squirt out. In fact, the amount of pressure in the veins uh, associated with this kind of bleeding is equal to the pressure in an artery, which is normally 10 times has 10 times more pressure in an abnormal situation with this bleeding vein. It's an equal amount of pressure, so about 100 millimeters of mercury pressure. Most commonly, when people have a bleeding vein like that, it's somewhere below the knee, often around the ankle, and the risk factor in terms of appearance is that the vein itself, the spider vein, takes on a very dark appearance. It's very dark blue, or even black, and that's because there's no other tissue between the blood and what you're looking at. So you're actually getting to see kind of what the blood looks like. It's very dark, dark black blue, and that is a spider vein that's at risk for breaking open. So if you do have a vein that breaks open, you can elevate your leg, put pressure on it, and use one finger on it with a little small uh, bit of tissue or paper towel or something, and put one finger on it. If you put your whole hand down, you may miss actually getting the pressure on the site, and it may continue bleeding into your under your palm or somewhere else. So one finger, hold it for about 10 minutes, gradually release the pressure. If you take it off right away, it actually creates like a suction effect where it's trying to seal up the bleeding. and you disrupt the little clot that's forming, and then it starts bleeding again, and you think, oh gosh, I'm never going to get it stopped. So you just gradually, over 3 or 4 minutes, just let the pressure off, and then if there is a uh, tissue or a piece of paper you put over there, leave it there, don't remove it, and put a piece of tape over it, and then you sit for another 10 minutes. It takes about anywhere from 10 to 20 minutes for a clot to stabilize. When it's stopping the bleeding, it begins to form an organized clot to plug the hole, and then that clot becomes adherent and attaches to the surrounding tissue, and that makes it much more solid and secure. So that takes about anywhere from 10 to 20 minutes. So you want to just sit tight and don't move, and then you can get up and sit up and test, see how it looks with just some pressure sitting up, and that usually takes care of it. So I've seen a number of patients with bleeding spider veins. It is a dramatic event. It's very scary. Most people, because of the amount of blood that they see, naturally are fearful that they're going to bleed to death. And the bottom line is that the risk of that is very low. If you just simply elevate your leg and put a little pressure on it, it will stop pretty much immediately. So this is Dr. Mike Ryan answering the question, is a spider vein dangerous or worrisome?